With World AIDS Day coming up, a friend of mine from Decatur asked me to answer some questions about my experience as a gay man in my 50s who saw HIV and AIDS when it emerged as a crisis in the 80s, and have worked in HIV since then in a number of capacities to talk about what my experience was with AIDS over those years. And he sent me 4 questions that I'm going to answer. First question was, what kinds of stigma or misconceptions were attached to HIV/AIDS in the 80s? What stigmas still exist today? Well, I think in the 80s, the biggest issue was that for most of the 80s, people didn't really know what was going on. They didn't know that there was a virus, HIV, how it was transmitted. They didn't understand that it was actually a disease that's fairly difficult to get. And so there were huge amounts of stigma in terms of even being near someone with HIV, touching them, kissing them, hugging them. Even medical professionals were afraid to reach out and touch someone living with HIV at that time. It was pretty dramatic. It was almost a shunning that happened to people living with HIV. And luckily, that level, for the most part, has gone away. Once in a while, you'll still hear about someone who, when their family finds out they're HIV, they don't want them to eat off the plates in the kitchen or things like that, but it's a lot less often today than it was in the 80s. However, the stigma that somehow the person who has contracted HIV is somehow dirty or deserving of dealing with this deadly disease because of actions that happened to them, that is still there. It was there in the 80s when it really was a deadly disease, and it's there today where HIV can be a manageable disease if you manage it. There also is connected with HIV a really strong stigma against gay men, and it was stronger in the 80s when gay men really were not accepted at all in our society, so there was a connection between being gay and having HIV. So sometimes people who were not out about their sexuality would die of HIV. You'd actually read in the paper that they died of some sort of cancer, or they'd go home to the little town they were from and no one would talk about the fact they had HIV or AIDS. And it was because there were no treatments then either. So when someone died, there wasn't really a long, prolonged treatment period where they'd been on certain medications or seeing certain doctors. And so there was a lot of fear about someone living with HIV. And it was then connected to all of the heterosexism and anti-gay sentiments that were present in the 80s as well. And I think some of those in some communities still carry on, and it still is a problem in terms of that association between gay men and HIV. His second question, as a gay man, how has the HIV/AIDS epidemic affected you and your social circle? Well, certainly in the worst of the plague years, in the 80s and early 90s, it was just a constant present of death. There were people around me, people who I loved, people who I cared about, who were part of my friendship group, who were part of my romantic past, people I dated, people I had had sex with, were sick and dying. And it was always in my mind. There was always something going on to remind me of it. And the best description I ever heard of it was from a man by the name of Callen, who since died of AIDS. He was an AIDS activist, and he was a performer. And he said that it was like you were living in a wartime. You were living and fighting in a war, but only the people inside your group knew that there was a war going on or was experiencing that war. And so you would sort of be with your friends, and you would all be feeling that shell shock, that emotional turmoil of your friends dying and wondering if you were going to get sick, and sort of just thinking about it. And dealing with people going into the hospital, having to deal with everything that was involved with being sick. And then you'd sort of go to the grocery store, you'd go to somewhere else in your world, and everybody was acting as if nothing was going on, as if it was just a normal day, it was just a normal month, it was just a normal year, it was just a normal decade. And so for the people inside, it was a wartime. It was a time of death, of destruction, of battles. But for the people outside, they didn't even realize that it was going on. So it was almost overpowering in terms of the impact of HIV/AIDS on my gay circle of friends during the 80s. Today, it's still present. It's still something that concerns people. It's still something that comes up, but not nearly as much as it was. That there are still people who are scared about getting sick and who are worried about what might happen to them if they do have HIV. But for the most part, it's a manageable disease now, and people are managing it, and people are living healthy lives with the HIV virus. Third question, what can be done locally to advocate for HIV-positive individuals? Well, I think today the biggest thing is, back to that first question, is about stigma, that someone who is HIV positive today and is able to get into treatment and get on effective treatment is just as likely as anyone else to live a full, healthy life. They're as likely to die from getting hit by a bus as by an AIDS-related illness if they're getting treatment. So one of the things that you can do to really advocate for people living with HIV is to advocate for more money for treatment, more treatment options, easier access to treatment. That treatment for HIV, while it is available, is still very expensive. And there are government programs that help people who don't have the resources to access the medical care and medications that they need to stay healthy. But there are limitations and rules and red tape around that process of getting that medical care. You know, in the height of AIDS activism, ACT UP, which was AIDS Coalition to Unleash Power, that I was part of at the time as an activist, they had, one of their first demands was universal health care for all. And we never got that demand met. We got treatment for people living with HIV with all of these government red tape and bureaucracy, which is great because it's keeping a lot of people alive. But there's a lot of people who get stopped, who that lack of easy access to medical care stops them from getting the treatment they need. So really, one of the best ways to advocate for people living with HIV is to advocate for universal health care, to really change the way health care is delivered so that everybody can get the health care they need at no cost, with money not being an option. So that would be one way. And then the second way is the stigma, that if you know someone who is living with HIV, just don't even think about that in terms of how you treat them, whether, you know, how you interact with them, that's just a part of their life like anyone else's chronic disease that they're managing. If you would not do something differently, if a friend of yours had diabetes or had, some other disease that is affecting their life but doesn't really affect yours, you want to treat the person living with HIV the same way. You don't want to treat them any differently. And third, to sort of challenge when people don't do that, when people are saying, oh, I wouldn't date someone who's HIV positive, or I wouldn't eat with someone who's HIV positive, which is ridiculous because there's no way sharing food with someone can transmit the HIV virus. Or if someone said, you know, I wouldn't want someone with HIV sleeping in my house or in the same workplace as me, all of that is ridiculous kinds of statements that need to be challenged. Or if someone said that people with HIV get it because they did something wrong, and that somehow it's the punishment. There was a big thing in the old days that it was God's punishment that a lot of people said, and that kind of talk is just ridiculous as well, and needs to be challenged every time it comes out. So those would be some ways. So supporting universal health care, reducing your own stigma and your own possibility of treating someone who's HIV positively different than you would someone who's HIV negative, and challenging HIV stigma when it shows up in your world. And the last question is, what kinds of local, national, or worldwide resources are available for those who want to learn more about HIV prevention, testing, education? So there's some great resources out there, and it really depends on your focus. If you want sort of medical facts, AIDS.gov, AIDS.gov is the site that's run by the U.S. government and is administered by the White House Commission on HIV/AIDS, and they are a great resource in terms of finding treatment centers, testing centers, having access to the latest material that the government is putting out about HIV. So that's a great website to visit. And from that website, they have a locator where you can locate local sources, local AIDS service organizations, local treatment centers, that you could then get involved with those particular places locally by finding them on the AIDS.gov site. Center for Disease Control, the CDC website, is also an excellent site in terms of finding the latest information, especially for things like statistics and risk factors, things like that. The CDC site is excellent. Two sources that are non-governmental that are wonderful as well is the Treatment Action Group, TAG. The Treatment Action Group grew out of AIDS activism in the 80s, and it was folks who said, you know, we need to really study this for ourselves. We need to figure out what the science is behind HIV, and do that as just regular individuals. We need to understand it not as scientists, not as people working in a lab, but just as, you know, your average butcher, baker, candlestick maker, to understand what HIV is and be able to explain it in terms that everyone can understand. And so TAG still exists today. Just search in Google for Treatment Action Group and it will come up, and they publish great information. And then finally, if you're interested more in advocacy, there's a great national advocacy group called the HIV Prevention Justice Network. And the Prevention Justice Alliance really looks at HIV as an intersectional issue. It is something that is not just about the treatment of people living with HIV. We know that the racism, that systemic racism, plays a role in all of American society, and particularly in HIV. One of the issues is that people of color are overrepresented. They are more likely to be HIV positive than the rest of the population, and that has to do with access to treatment, access to prevention information, and the HIV Prevention Alliance definitely uses their lens of understanding this as HIV as a demonstration of the oppression that happens in the world, to help organize campaigns to fight against all kinds of oppression, and specifically on how it impacts HIV. So those are 4 ways that if you wanted to get more information or get involved, so the CDC website, the AIDS.gov website, Treatment Action Group, which besides its website also has publications, and the HIV Prevention Alliance. So those are some things to do. And on World AIDS Day every year, I think about my literally hundreds of friends who died during the worst of the plague years. And I also think about one friend who committed suicide fairly recently, only 2 years ago. He was HIV positive all through the 80s and 90s, but lived to get treatment and started treatment in the mid-90s. But he never recovered from that war. He never fully re-engaged in his life. And a couple of years ago, he committed suicide because he couldn't come back to a world after what he had experienced. And he was actually the first boy I ever had sex with when I was in high school, and he was a friend of mine from childhood. And I think about him on World AIDS Day because the war of the plague years, the war of the HIV epidemic, leaves casualties like any other war on the field, but also sends home broken people who, if they don't get the help they need, don't make it. And he was one of those. So HIV today is a manageable disease, and that's a wonderful thing. But there's still a lot of stigma. There's still a lot of pain. There's still a lot of hurt that is yet to be healed from the worst of those years. And that's what I like to focus on World AIDS Day.